Hello everyone, it's your next door nurse Florence and you're welcome to my YouTube channel. Today we're going to be talking about shock, some of the signs and symptoms to look out for, and what to do when a person is in shock. If you're just joining us, welcome to the family. Kindly subscribe, click on the notification bell so you'll be the first to know when I drop new videos, and give me a thumbs up by clicking on the like button. What then is shock? It is a life-threatening condition that occurs when the body is not getting enough blood flow. That is, the body, the organs, the cells of the body, they are not getting enough oxygen and nutrients to make them function properly. It's like a, how do we put it now? It's like a defense response by the body. When there's a sudden drop in the blood pressure, the body responds to this sudden drop in the blood pressure by constricting, that's narrowing, reducing the blood vessels in the extremities, that's our hands and our feet, so that there will be enough blood flow, there will be increased blood flow to the vital organs. Shock can be caused by extensive burns, maybe fire or chemical, loss of blood, could be internal or external, hypersensitivity reaction, that's severe allergic reaction. There are some people that are allergic to some things like dust. It can also be caused by dehydration. This is when the body loses more fluid than it takes in. It can be caused by poisoning. That's when you inhale or ingest harmful substance. By severe illness, for example, heart failure, and blood infections, when a bacteria causing infection in one part of the body enters into the bloodstream. So then, what are the signs and symptoms to look out for a person with shock? The person will have cold and sweaty skin. They'll be weak but rapid, that's fast pulse rates, irregular breathing, profuse sweating. There's dizziness, increased thirst, anxiety. The person will be confused, and there's irritability. And also, the person can even have reduced blood pressure. If you have sphygmomanometer at home and you want to check, you find out that the person's blood pressure is low. They can also be reduced urine flow. How do we save a person in shock? The first thing you need to do is to lie the person down. You elevate the leg of the person slightly higher than the head. This is to enable increased blood flow to the heart and the vital organs. You loosen any tight clothing the person is wearing. Then, if the shock is as a result of bleeding, stop the bleeding by applying pressure with a clean cloth until the bleeding stops, or you can use a bandage to tie and apply pressure until the bleeding stops. If the patient is cold, if you touch the body and you find out that the person is cold, you can cover with a blanket or a clean cloth. If the shock is as a result of dehydration, you can give lots of water to drink before you seek medical help or take the person to the hospital if you can. If the person is unconscious, lie the person down, turn the head to one side, either the left or the right. Do not give the person anything to drink or anything to eat. Check the mouth if there's any accumulation of saliva or vomitors. Clean it to prevent aspiration. That's the person breathing in the vomitors or the saliva into the lungs, which can cause a lot of problems for the person. Then you can seek medical help. But if you can, transport this person to the hospital, but make sure that the leg of the person is slightly higher than the head at all times. With these tips, I'm sure you can successfully attend to a person in shock. If you want more content on how to save your life, kindly subscribe to my channel. Click on the notification bell so you'll be the first to know when I upload new videos. Give me a thumbs up by clicking on the like button if you find this video helpful. You can also drop your comments and your questions in the comment section below and I'll attend to them. Don't forget, I'm your next door nurse and I'm just a knock away. I love you guys. See you in my next video.